All right, so PNR 208 Community HESI Review. All right, so the first thing we have are the levels of prevention. So what is primary prevention?
Like preventing it, like giving education, pamphlets on it, brochures.
All right, so
Preventative
primary
care,
is
like education,
okay. So education, family planning, right? Communicable disease prevention, education about hygiene issues, safety education, prenatal classes, immunizations, right? All of those are primary prevention measures. So remember, primary is prevention. What is secondary prevention?
Screening,
Screening, right? Secondary is screening. So early detection and treatment of disease with the
like blood
goal of
pressure screenings, blood sugar screenings, stuff like that.
Very good. Right. We're looking at limiting severity as well as adverse effects, right? So exactly. So your blood pressure screening, your blood sugar, your cancer screenings, it's even disease surveillance, community assessments, lead exposure, right? And then what's tertiary?
Treatment.
treatment.
Tertiary is
They
treatment.
already have the disease, so you have to like do stuff to take care of it.
Right. So, yep, absolutely. So, right, we're doing like PT and OT, could even be exercise programs, nutritional counseling, but we're looking for maximization of recovery after an injury or illness. Good job. And we have can't even say the word tonight. Epidemiological concepts. So what though we have the epidemiological triangle, which is your host, your agent, and your environment. What are some things that make a person more susceptible? So what are some things that would make the host more susceptible to contracting a disease?
Weak immune system.
Very good. A weak immune system.
Very young, very old.
The very young and the very old. Very good.
Like pre-existing health conditions.
Okay, pre-existing health conditions, so their physiological state. Good job. Their job, excuse me, their job also, right, could potentially put them at risk. um, Genetics, right? Agent. So some of the agents that we have that could be chemical, could be physical, could be infectious, right? So drugs and toxins and noise and temperature and viruses and bacteria and fungi and all of those good things. Um, and then the environment, right? So things that are in the environment that are potentially part of this epidemiological. It's right, it's the settings that surround the host. So, think of their food and water supply, any presence of reservoirs or vectors. Do they have access to healthcare? Or do they work in high risk working conditions? Do they live in poverty, right? Those are some things that would put us at risk. So what does endemic mean? Hmm. Uh-oh, I got you somewhere. Did y'all leave me?
No, I'm here.
Okay. I was like, it got really quiet. You guys were answering. Um, so endemic, right, is something that regularly occurs within an area or within a community. So think of, There are certain diseases that are going to be endemic to certain areas. What is an epidemic?
Is epidemic like global and pandemic is like specific to one like region or something like that?
Opposite. Opposite. Pandemic would be global, like COVID-19, right? Was a pandemic. Epidemic is where, say, we have an endemic disease, let's say like malaria, okay, that's endemic to the area. And then we have an increase in those numbers. It beyond the normal amount, that would be an epidemic, like a flu would be an epidemic, something along those lines.
So epidemic, you would say is like within a specific population, and then pandemic is global.
Correct.
Okay.
Yep. Very good. What is a vertical transmission? Remember your
Is it something like where it spread like from, wasn't it? It was like it spread from the
mom.
mom to the baby or something. I don't know.
Here you go.
Something like
Yeah.
that.
Yep. It spread from mom to their offspring. Then what would be a horizontal transmission?
I guess between the same.
Right. So, I have the flu and we're in a room together and I'm sneezing and coughing and spreading my germs, right? And then you get the flu, right? So that would be a horizontal transmission. When we look at immunity, what is active immunity?
Is that from like when you get the vaccination?
Okay, so we can get active immunity for immunization, or we can get it right as a result of getting the disease, right? So if I had chickenpox as a kid, right, generally speaking, if I'm exposed to chickenpox again, I already have the antibodies that is going to respond to it. What is passive immunity?
From the breast milk?
Right. So that's from either mom to baby, right? Or it could be that we give immunoglobulins. So I have a disease. So we did this during COVID. I don't know how many people remember, but somebody recovering from COVID, right, has those active immunoglobulins, right? And so we took their immunoglobulins or we took their blood and we gave it to somebody that was currently fighting COVID. Um, it's also, antitoxins as well, would also provide your passive immunity. Then we have bioterrorism and disasters. So, what is anthrax?
The bacterial infection
Okay.
caused by the I don't know, what is it? Bacillus something.
Bacillus anthracis. Very good. Uh-huh. All right. How is it spread?
Um, it found in like the something with the soil with the animals. I remember something about it said something that was in the soil and like the cattle and stuff. Get it? I don't know.
The soil and this, okay. I'm just trying to like follow you. So not we don't use it, but anthrax can be a weapon of bioterrorism, right? So hold on, somebody else is coming in. All right, so it's transmitted through contact with um spores usually by skin contact with, you're right, infected animal products, inhaling the spores, or even eating contaminated meat. Um, Generally, anthrax is not spread person to person. Um, it usually, will get in through like cuts or by breathing. So some of the main transmission routes when we look at bioterrorism would be through the skin. So they get through like in through cuts or um, abrasions, or it can be inhaled. What are some of the manifestations or the signs and symptoms of inhalation anthrax?
Flu symptoms.
Okay, so headache, fever, chills, muscle aches, shortness of breath. Um, okay. How long is the incubation? So it could be for the skin, it could be anywhere between 1 and 12 days. Inhalation can be 1 to 7, but it can be a lot longer as well. Um, it just really kind of depends on how the spores respond or the spores act. What is the treatment for anthrax? Anybody know?
I'm gonna guess since it's bacteria, an antibiotic maybe.
An antibiotic, yep. So we can do antibiotics, usually two. We can also do antitoxins as well. And then if we've had an exposure, so say you're working in the emergency room and we have a client that comes in and you haven't had your anthrax vaccine, we can do Cipro, as uh, what is it, a post-exposure medication. All right, what are the three levels of disasters? So, what is level one?
Local.
Okay, so give me, like, what does that mean, local?
Like like a small, I guess maybe like if there was like a fire or something in a town.
Very good. Okay, so more local. So what would be level two?
Could that be something like maybe like a hurricane where you, I don't know, it was something where you're going to need help from other
Right.
areas where it's something bigger.
Okay, something bigger. Yep. So it's usually enough to where we may need to bring in some outside resources, right? And then of course, you know, um, so when we look at the phases of response, so what are some of the biggest things we have with that we need to worry about with the phases of response? So if I have, let's say there's a, let's say there's a flood. Um, and sorry, I'm trying to pull up the chat. Let's say there is a flood. Um, so what are some actions? What are some things that need to be done during that disaster? Like, what's the first? What is the first thing we do with it when we have a disaster?
Well, we need to evacuate. Like we need to get the people to a safer environment from where they are.
Right. So respond, right? So we have to rescue and we respond. So that's where you're exactly right. We're going to provide immediate actions to try to save lives, you know, get them out of harm's way. We can provide the emergency medical care. We can do search and rescue, secure the scene, that kind of thing. Very good. And then after rescue, then we have relief. And so anybody that is a victim of that flood, we are going to try to provide them shelter, food, um, essential supplies, and then looking at, restoring whatever the, services are there, and then recovery. Recovery is the last phase. It's usually a little bit longer. This is rebuilding, restoring communities, and getting back to like a normal way back to the previous or a normal way of life. Um, so we kind of, when we look at that, what is when we look at disaster planning, right? So, you can only plan so much, right? Because, you know, you can kind of, learn from previous issues. Um, So one of the big things with disaster planning is developing a disaster response plan, right? So based on the most probable disaster threats. So depending on where you live, right? Hurricanes, tornadoes, flooding, blizzards, and it just depends on kind of where you live, right? And look at what is, the warning system all about. Where's communication, how to access the communication. Um, and then, we're going to look at in that disaster planning, we're going to look at triage. So we have the red tag triage. What is the triage system?
Prior what is it? Prioritization of like basically the severity of
The injuries,
the
health.
injuries. Yeah.
Right. So you're
Save
looking
who you
at
can
the
save, and like if there's people that are dead, like mark them so you know.
They get like a black tag or something.
Yes. So, yep. So level one or red tag, right? They're the ones that are going to have the immediate life-threatening injuries that need to be taken care of right now, right? Your yellow tags, they are serious, but their injuries aren't life-threatening. They still need to be treated, but they can wait a little bit longer. Your green are minor injuries. A lot of times they are the ones that are going to take themselves to the emergency room. And then black tags, those mean that um, they've already passed away, or their injuries are so severe that they are expected to pass away. So knowing the triage system. Um, Other things with disaster planning is, helping community members get their own personal, um, what's the word I'm looking for? Their own little personal kit, right? Or, doing their own disaster planning, right? So in the event of a hurricane, a tornado, a flood or something, an earthquake, and they need to evacuate, right? They need to have a plan. They need to have a plan for evacuation as well as have a disaster kit. What are some of the things that should be in that disaster kit?
Documents.
Documents. Good
I,
job.
somewhere I saw it said pet food.
Yeah, what if you have pet? Look, I'm not going anywhere without my dogs. Like, I'm sorry, not my dogs are like, they're like my kids. My kids are adults. I got dogs now.
Flashlights, extra batteries.
hmm
I think it said your charger for your cell phone. Your cell phone. I think
Yep. Have a charger, yeah.
Um,
Um,
wa-
Gallons of water, no, non-perishable food items.
yep, have at least 3 days supply of food and water. Even, some extra clothes, some hygiene supplies, um, medications, right? Sometimes I was thinking about this, as I teach this class, and I think about like, how do we do medications, because that was sometimes is going to be something that you're going to have to grab last minute, right? Because, you can't always have, extra medications laying around. So that is something, but the CDC, the American Red Cross, they also have really good resources for families to create their own emergency plan, right? They should know, like to like let somebody know where they are, where they're going, that's outside of the area, what to do if they get separated from their family and stuff like that as well. So that's another thing that, we really need to look at. Another one is disaster communication. So tell me about disaster communication. So tell me about the person that is going to be in charge of the communication.
what
What type of person, what type of leader do we want in charge of communication?
Someone who's good in like emergencies and at like handling chaos. Maybe somebody who has experience in like emergency rooms and can direct people like with a leadership personality. Like, okay, this person goes here, you go here, you go here.
Right. We need someone with that autocratic leadership style, right? To be like, hey, this is what you need to go here, you need to go there, you know. So right. So very specific instructions, making sure that we are getting that communication timely. Um, that we are reaching as many people as we can with that communication, and always make sure, right, that it is just wherever the messages are going, that it's all the same, that everybody is getting the same information, because we really just need that really good, clear, timely, specific instructions. This is what everybody needs to do. So, talked about natural disaster kind of preparedness is all kind of the same thing. All right. All right. So here we have, a practice question. So a nurse is triaging, a nurse is triaging the victims of a disaster. Which color tag would the nurse select for each of these four patients? So you have green, yellow, red, or black. So one, a child who can't move his right leg but has palpable peripheral pulses. Then we have a middle-aged man who is ambulatory and has a laceration on his forehead. Then we have a frail elderly woman with a severe head injury who is unresponsive, and a young woman with an obstructed airway who is struggling to breathe. So,
I think D would be red.
mhm.
okay, D would be red. Okay.
I think
A,
yellow.
A would be yellow. Okay.
C would
Um,
be black.
And
C
then
would be
B would
black.
be
B
green.
would be
And B would.
green. Yeah.
Good job. Yep. So the little boy the little boy who can't move his right legs but has pulses, he is yellow. Absolutely right. He needs to get seen, but he still has pulses, so he is good. His middle-aged man who is ambulatory has a laceration on his forehead. He's green, right? He's good. The poor, frail, elderly woman with the severe head injury who is unresponsive, definitely, unfortunately, black. And then the young woman with an obstructed airway who is struggling to breathe is definitely going to be red. All right. So more about epidemiology. So flu surveillance. So what is flu surveillance? What does it mean to surveil something?
Keeping track of who gets the flu.
Right, we're kind of keeping track of the numbers, right? So it's data collection, it's analyzing the data regarding the flu. We're looking at patterns, right? Who's affecting, is it, when we look at flu, right? We look at the very old, the very young, to kind of see, how it is affecting those populations. Um, we look at, I'm going to skip SARS for just a second. So we look at the CDC and their um, reportable diseases. So the there is your state health department is going to have their own list of reportable diseases. Um, but the reporting of communicable diseases is mandated by both state and local regulations. And then state notification to the CDC is voluntary. But what are some, the CDC is going to provide a list of those diseases that need to be reported to them. So give me some examples of CDC can't even say the word, CDC reportable illnesses. Talked about one already.
COVID.
Okay. Excuse me. What else?
Would it be the
Maybe measles.
Measles. Uh-huh.
don't you report STIs to the CDC too when you have like outbreaks or something like that? Like when they too high, the statistics is too high.
So syphilis, definitely. Um, Gonorrhea. But yeah, I mean, some of you, a lot of your syphilis and gonorrhea probably among the biggest ones, like things like chlamydia, maybe not.
What about
It's
HIV?
HIV, absolutely. Other things like anthrax,
Would the
your
flu,
measles. Go
would the
ahead.
flu be one because they have different variants or no?
Um, Influenza, if it causes, well, it depends. I think the last time I checked the CDC, is if it was a peds death, then it would be reportable, but that's been a while since I've checked. But it is possible.
What was that other one? It was something else that when it was monkeypox. Was it
Oh
monkeypox
yeah,
one and
that
Ebola?
monkeypox. There's another name for monkeypox, and now I can't think of it because you said monkeypox. Shoot. But yes. Um, I can't think of it now. Um, it's okay. It doesn't have to. Um, but yeah, so a lot, just think of like your immunizations, your measles, mumps, rubella, your I'm trying to think of what else. Smallpox. Talked about syphilis. Talked about gonorrhea, diphtheria, your hepatitis infections, your HIV infections. Those are all reportable. Rabies, is also reportable. Your SARS is reportable. So your severe acute respiratory syndrome is reportable. It's kind of why I skipped that for just a second. Tuberculosis is also. Um, and even cases of Staph aureus are reportable as well. Always just double check. The CDC website is going to be the best way to see that if it is reportable or not. So with that, that brings us to SARS. What is SARS? So we know it's severe acute respiratory syndrome. But tell me a little bit more about it. I know. Is it bacterial or viral? Let's start there.
Viral?
Viral.
Sorry, then my dog. Say that again. It's viral. It's viral. Okay. So it is a serious form of pneumonia. It's caused by the SARS virus. What are some of the signs and symptoms?
Isn't it like COVID?
Fever.
Yeah, it's a lot. Some of the symptoms are a lot like COVID. Yep. So the high fever, chills, the headache, the body aches, and then progresses to a dry cough and pneumonia. Um, Transmission is generally through close person-to-person contact, through respiratory and droplets, from coughing or sneezing. Um, and so um, that is, that's basically SARS. Um, what is the treatment for SARS?
Um, I don't know. I thought virus is normally you just let it go, on its own, clear on its own.
Yep. Yep. So we can do symptomatic care, right? Unless they were severely ill, right? And then some patients may have to be intubated and mechanically ventilated um, depending on their status. Good job. Talked about vertical transmission already, right? So that's mom to baby. All right. Health promotion and teaching, infant death rate. Where do we find information about the infant death rate? The infant mortality rate. So the infant death rate is the death of infants under 1 year per 1,000 live births. Um, and so where could we find this information?
The health department,
Okay. We can find it um on the at the health department. Where else?
Would it be the CDC, depending on type of death?
Yeah. The CDC does keep a record it keeps a record of the infant death rate. So you can go to the CDC, and you can look at what the infant mortality rates. It usually also will list a cause, excuse me, of death as well. What is some things that we're going to assess when a patient has obesity?
Their blood pressure,
Okay, blood
family
pressure.
history, medication,
Okay,
their diet,
their diet. Very good. So
lifestyle, if they exercise, or if
very,
like their work.
yep. So their diet, their physical activity, their stress. Remember, stress is going to play a big part in that too, right? Their medication history, their medical history. We're going to do vital signs. We are going to do their BMI, right? So we can get the BMI as well. Um, we can do body composition studies and things like that, right? We're also going to check their blood for cholesterol and glucose. Um, for lipid screening, when do we start lipid screening?
I don't know, is it adolescent? Maybe 17? Because I remember getting mine at like 17, 18, but I don't remember if that's
Yep.
like
So
right.
with high risk, we can start as early as 9. right? So some of those high risk, if they have, family history or if they have risk factors. So my husband is Hispanic. So all of my kids, they started getting their cholesterol checked at around 9 or 10, just because, for one, they're Hispanic. So genetics plays a big part in that. And my husband also has hypercholesterolemia as well. um, Patients that have hypertension, if they have diabetes, right? Those would be some early screenings that we would, check their lipid levels for as well. All right, conjunctivitis. Conjunctivitis is pink eye. All right, so what does pink eye look like?
Like itchy red eyes.
Itchy red
Like
eyes.
crusting around the eye,
Okay, crusting
oozing.
around. Yep, oozing. What are some treatments that we can do for pink eye? So for bacterial conjunctivitis, what can we do for bacterial conjunctivitis?
The
Anybody?
antibiotic.
Okay,
And for
antibiotics.
comfort, like a warm compress on the eye and wipe from in to out.
Right, we're gonna wipe from the inner canthus to the outer canthus, right? So that helps to prevent cross-contamination to the other eye. Um, Compresses, and then if, when can they go back to school?
And
I don't
Is it
think
like 24 to 48 hours or something like that after treatment or something?
After, yeah, after
after
the
the first,
antibiotics.
yeah, after the first 24 hours of treatment.
Yep, very good. So once they've been on those antibiotic eye drops for 24 hours, they can go back to school. What are some ways to prevent it from spreading within the house?
Hand washing.
Hand washing. That's always the best answer, right? Hand washing. Wash your hands. Yes, absolutely. Don't
I don't know.
share.
My siblings used to say that if you fart on the pillow, that's how you get pink eye.
So it is actually,
right.
it's the same bacteria. So it is actually, in a sense, that is true.
I guess like don't share like the same pillowcases and stuff like that. Like,
Yep, no sharing of towels, washcloths. Very good. Yes. Because I remember, and Sarah, the only reason why I remember that was because when my youngest was little, I had gotten pink eye. Um and I worked in peds, so I mean, go figure. Um and so when I went to the doctor to get the medication, um, I told her because my son had said, I farted on your pillow and that's why you got pink eye. And so she laughed and I laughed and she was like, in a way that's true because it's the same bacteria. So that's the only reason why I knew that answer. Kids are a lot smarter than I guess we give them credit for because he was only like 5 or 6 when he did that. So, um, tell me about eczema in school sports. What are some things that we can teach our student athletes that have eczema?
just to make sure they have good hygiene and keep their skin like dry. I mean, not dry, moisturize their skin, but after they're like sweaty and stuff, they need to clean it.
Hmm. So they need to
Moisturizing
shower.
creams, like unscented, thicker creams like Eucerin, Aveeno, stuff like that.
Yep. Yep. So using some of the like more breathable like clothing or whatever, fragrance-free detergent, cool showers, making sure they are using moisturizers, hydration.
Tell them
Um,
to, when they take a shower, make it like get in and get out, like, because you don't want to be in the water too long. 'Cause it'll make
exactly.
your skin worse.
Yep. and make sure they dry really good afterwards, especially their feet. Um,
I
but yes,
I think I read somewhere that they're not supposed to take really hot showers too.
no, cool showers.
No, you're
Yeah,
not. I got eczema. I could tell you all about it.
me too. But no, cool showers. They're not supposed to take hot showers. Absolutely correct. Nice cool showers, which is fine during the summertime, but during the wintertime, it's kind of hard to take a cool shower. I'm just saying.
I
That's
need
just
a hot
me.
shower no matter what.
I know it's hard. It's like, oh, um, all right, lead poisoning. What do we do for lead poisoning? I know.
Assess
Oh,
the home for like if it's built before a certain time, I think.
so we're gonna do um so sorry, I forgot my drink and I'm trying to get my son to bring it to me. Um so yeah, so we'll do a lead levels, and then depending on what the lead level is going to determine what the next step is, right? Um so some of it's, how do we um we got to look at removing the source of the lead. Um, and so what are some sources of lead that we may find?
Like the old paint chips.
Yeah, so generally speaking, it's houses that were built before 1978. Most of them have been cleared of lead paint, but it is still a possibility that may have it, right? So we need to remove whatever exposure that they've had. So interesting thing about lead paint is I learned this from the doctor that I worked for when I worked in peds. So the lead, like the chips from the lead or whatever, it has a sweet taste. And so that is why kids are prone to eating the paint chips, is because it has a sweet taste to it. I don't know why. But yes. Um, Even some cribs, some toys. So we need to kind of look at, where the source is, and then depending on the level, right, we're going to report elevated levels to the health department. And also, depending on the level, right, they may need to have treatment, which is chelation therapy. Chelation, it kind of binds to the heavy metal, and helps to remove it out of the system.
And you said the homes were built before when?
1978.
Okay.
Yep. So that was one of the things when we actually bought our first house. It was built in 1978. And so we actually had somebody come out and check all of the paint and stuff like that to make sure that there was no lead in the house. So it was a requirement that we had to before we bought the house. And it was fine, but it was just interesting. Um, all right. All right, here's another practice question. So we're going super slow. I have to move faster. A child's been diagnosed with bacterial conjunctivitis. Which clinical manifestations of bacterial conjunctivitis would the nurse expect to note? Pain, select all that apply. Pain, itching, swollen lids, inflamed conjunctiva, it's supposed to be serous, not serious. Watery drainage, crusting on eyelids, especially in the morning. Which ones are we going to see?
Is it all of them except for five?
Okay. So
I was about to say all
bacterial,
of them except for one, but never mind.
Swollen lids, inflamed conjunctiva, crusting on the eyelids, especially in the morning. All right, another question. Nurses reinforcing home care with a child with bacterial conjunctivitis. Which instructions would we give?
3.
Yep. So the some of the rationale, right? 24 hours after antibiotics, they can go back to school. We never use save any unused medications, right? And then we always wipe from inner to the outer, not outer to inner. All right, the nurse is planning a program to promote secondary prevention for coronary artery disease. So secondary. Which of the following interventions would the nurse include in their recommendations?
What?
Secondary.
Lipid screening?
Very good. Lipid screening every 5 years for adults at low risk. All right. A community health clinic is offering a class about lead exposure and toxicity. Which information should be included in the class? Select all that apply. So we have children in low income households are an increased risk. Lead toxicity most affects children over 6. Lead containing products can be inhaled or ingested. Blood levels can be obtained through a simple finger stick, or there is no risk to pregnant women with lead exposure.
Is it 1, 3, and 4?
1, 3. Very good. So yes, children in low income households are at increased risk. Lead containing products can be inhaled or ingested. And yes, blood levels can be obtained through a simple finger stick. Good job. All right, a child is hospitalized with a diagnosis of lead poisoning. The nurse caring for the child would prepare to assist in administering which medication?
I don't know.
So, all right. So, okay. So I'm just going to go through them real quick. Does anybody know what syrup Epicac does?
No.
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 So, a syrup of Epicac is a medication that makes you vomit. Activated charcoal, we use that for ingestion of poisons as well, or even medication. Um, and then sodium bicarb. Um, thank you.
Isn't that
Um,
baking soda?
yeah, basically, it's very similar, except we don't give them baking soda, but yeah. So dimer carpal is a chelating agent. And so again, the chelating agents are going to bind with the lead, and that helps them to get it out of the bloodstream, out through the kidneys, and out of the body. All right, what do we limit in a heart healthy diet?
Fats.
High
Cholesterol?
sodium.
Yep. So we are going to limit fats. We're going to limit sodium. What are we going to increase?
Protein? No.
Healthy fats.
Fruit and
Health,
vegetables?
Oh,
Fresh
right? Fresh fruits,
vegetables.
vegetables, healthy. Yeah. So avoiding, right, the of the processed foods, the right, that kind of thing. Okay, you're all correct. Um, Elder health assessment. Tell me about assessing an older adult.
Fall risks in the home, like rugs, side
Okay, so
rails.
Safe food,
Yep.
nutrition, make sure they're physically don't have like bruises and stuff on their body, sores.
Okay. So nutrition, what about their medications, right? Assessing for polypharmacy. Um, then even trying to think, their ability to perform their ADLs, right? Can they cook for themselves? Can they get their food? Um, what's their independence? Like, yes, fall risk is a big thing in our elderly. What's the vision screening protocol for preschoolers?
Is it the Snellen chart or is it the symbol chart?
Yeah. So it's still a Snellen chart, except they use symbols. They can use pictures, they can use symbols. Some of them have like the E's that go in different directions, and they can just point like which way is the E facing. What are we looking for?
Is that, I don't want to be wrong. Is it accommodation?
Oh,
No.
and what else? It begins with a S.
Hmm. Symmetry?
No, ST. I'll give you another letter.
Stigmatism?
Not yet.
I don't know. Only thing I can
You're a
think.
big miss. What is
Strabismus. There
Oh,
you go. Very good.
that's
Oh my goodness. It was all right. It was all good. All right, you got it. Yeah, we're looking for things like amblyopia, strabismus, even refractive errors. Oops, I didn't mean to hit my screen. Or even refractive errors when you're trying to get them early, right? 'Cause if they can't see, they're going to have a hard time in school, right?
What's your
Scoliosis,
business? I'm sorry. What's that word
um,
that she said?
strabismus, like a cross-eyed.
Okay, thank you.
Mm-hmm. Well, I mean, they could go cross-eyed or they can go out. But basically, what happens with strabismus is their eyes don't focus together on the same object, if that makes sense. Um, Scoliosis. How do we screen? What do we do for scoliosis? How do we screen for scoliosis?
them bend down and touch their toes.
Right? You're gonna have them, yep, you're gonna have them in front of you. You're gonna have them bend over and touch their toes, and you're looking at their spinal line. My gosh. Um, um, spinal alignment, geez. Um, and so I don't know if they still do this in school or not, but we did this when I was in school. Um, what are some of the priorities with somebody that has scoliosis, other than getting them, early treatment to prevent, um, or to try to prevent it from, getting worse? What do you think are some issues with scoliosis?
Back pain,
Back
leg pain.
pain, joint pain, hip pain, right? Depending on the level of scoliosis, right? Could have respiratory issues. But the goal, right, is to prevent worsening of the curve. So, catching it early just helps for better treatment options. Healthy People 2030 goals for adolescents. What are the Healthy People 2030 goals for adolescents?
It's, like for obesity and like substance abuse.
Okay.
Safe sex, drug use, car safety,
What about car safety?
how to use a seatbelt correctly.
How to use it. I like that. how do we use it? But absolutely, yes. So yes, we want to um increase a lot of the during adolescent period of time is about risk behavior, right? What then we also want to provide education about healthy nutrition, um, exercise, getting adequate sleep in addition to those safety concerns, sorry. Give me a primary prevention measure for adolescent.
Uh,
It can be anything.
birth control.
Birth
Sex
control.
ed, driver's
Say that,
ed,
say that again.
driver's ed.
Driver's ed. Okay. Immunizations, right? All of those would could be primary. Talked about seatbelt safety every time, right? Some of the health, teaching, diet, exercise, avoiding alcohol, tobacco, other illicit drugs. Also, we want to also support mental health, right? That's another thing that we need to look at as well is, you know, do they have an adult that they can talk to about a serious problem? So looking at, increasing those supportive relationships. Um, Education. So community education. So how do we evaluate community education? What are some ways that we can evaluate community education?
Maybe like a survey throughout the school.
Okay, a survey throughout the school. We can do a pre-survey, right? We can do a post-survey, right, to gather information. We can also look at
What about test
um,
scores or something? Maybe like their what their scores are for the kids in their grades.
okay, okay. I see what you're saying. So, okay. So yeah, so what are, looking at this is looking at if we're doing let's say we're doing a health fair for the community, whether it's for hypertension, obesity, whichever, and we're going to provide this, this learning, this health fair or whatever. How do we it's about looking at how effective was the health fair. Um, and so yeah, so we can do, looking at um doing surveys is one way, right? We can do pre and post surveys um, to see about the effectiveness of the education plan. We can also, continue to look through the community to identify the needs, and maybe make changes to the education plan that way. Community resources for the rural population. So, what do we know about the rural population? We know that they're a vulnerable population, right? So, what are some community resources that would be effective for the rural population? So, we
Increasing
know that,
telehealth,
okay, telehealth. Okay, that would be awesome. What else? So they have limited access to healthcare, right? They may not have transportation. They may not have the ability to pay for care. There also may be a shortage of healthcare providers, right, that they have access to, right? So we can, a lot of what we want to work with, is really looking at prevention measures too. So some of your primary prevention would be cancer prevention and care, mental health care, substance use prevention. We want to offer immunization programs, family planning programs as well. Um, so we can help them apply for resources if they can't, if they need help with resources, um, we can, even, like you said, telehealth, your like mobile, um, clinics, things like that, that we can bring out into those communities. What is some teaching that we would do for skin health?
Keep your skin clean and moisturized.
And keep it clean and moisturized. What about sun exposure? What can we do to help with sun exposure? Teach them about
Sunscreen.
SPF
sunscreen.
every day, especially on the face for wrinkles. So like avoid getting wrinkles.
Okay, and decrease the risk for skin cancer, right? Don't go out in the
Yeah,
sun.
that too.
Don't go out in the sun, right, during the hottest periods, which is like what, 10 to 2 or 10 to 3, something along those lines. Long sleeve shirts, long pants, wide brimmed hats, right? Protect the skin, do your daily skin assessments. Um, all right, how can we reduce the risk of urinary tract infections?
How
Wait.
to properly wipe themselves, making sure they know how to properly wipe themselves.
How to properly wipe themselves, right? We wipe front to back. Very good. What else?
Avoiding tight undergarments and pants.
Wear cotton.
Yeah, cotton underwear. What
Peeing
else?
after sex,
Yeah,
completely emptying your bladder when you do go to the bathroom.
yep. So voiding after sex, completely emptying your bladder, right? Plenty of fluids. Okay. No, oh no, wrong one. Sorry, it's gonna go somewhere else. Food stamps, WIC, Meals on Wheels. All right, these are all agencies that are available to assist certain populations, right? So food stamps, for those that meet the income requirements, right? It gives them food or money for food on a monthly basis. WIC is your women, infants, and children. It provides resources for pregnant women and children, I believe, up to age 5. Um, so I just remember when my kids were little, when I was on WIC, um, it was like cheese, milk, eggs, cereal, milk, in addition to the formula for the baby. And now there's so much more that's on WIC. Oh, peanut butter was another big one. Um,
Miss,
but there's,
I'm sorry to interrupt. Are you going to post this recording?
of course,
Okay, because I got to get my daughter ready for bed.
I know, and I'm like running late, so I apologize.
No, it's fine. All right, thank you.
You're welcome. And then Meals on Wheels is a voluntary agency. They provide meals to the elderly and others that can't, that are homebound, unable to leave their homes. Um, and what are neighborhood safe houses? This is an interesting concept, right?
I don't know, never heard of
I
them.
guess where you don't have much crime and stuff. Where it's
So
safer.
I
it's
think I
it's
seen
somewhere
this
that
on,
go
yeah,
ahead.
the kid where the kids go if they're like they feel like they're in danger or being abused or something.
Oh, like
Right.
a safe haven, like a safety house. Okay.
Yep. Very good. Um, yeah. So, but yeah, so neighborhood safe houses They can be emergency shelters, or they could even be community programs for kids, where they offer, temporary refuge. They provide safety, counseling, those things like that, should they need it. All right. So what are some of the home health recommendations for heart failure?
They need to do daily weights.
Daily weights. How do we do daily weights?
Um, what you mean?
Same
Like,
time every day,
Oh, okay.
same scale.
very good. Yep. Same scale, same time, same amount of clothes. What else? So we're gonna do daily weights. What else?
Fluid restrictions, medication adherence.
Medication adherence, fluid restrictions, right? Want them to
Limit
track their
sodium intake.
symptoms. Low sodium. Yep, absolutely. Good job. Right. Want to make sure they're taking their medications like they should. We want to know if how much does a liter of fluid weigh? Anybody know? So a liter of fluid weighs 2.2 pounds or 1 kilogram, right? So that's why if somebody, think about it, if a heart failure patient gains 2 pounds in a day or 4 pounds in a week, right? That's 2 liters of fluid that they've potentially gained, right? Which could further exacerbate, right, their heart failure symptoms. NG tube feedings. What are some considerations with NG tube feedings?
We should check the placement of the tubes.
Absolutely. We check placement right prior to using NG tubes. What else?
Make sure they're not aspirating.
Okay, make sure so keeping the head of bed elevated, right, at least 30 degrees, right, to help prevent aspirations. All
Like the
right,
proper way to clean it.
right, make sure that they don't move it out of place. Um, okay. What's respite care?
It gives like the caregiver a break so they're not like too stressed out.
So I like the way you said that. So yeah, so respite care is it does. It gives the caregivers a break. So it's short-term relief. So they get temporary care. And so this respite care can be done anywhere. So in the facility that I work at, we take respite patients all the time. Sometimes they're there for a couple of days, sometimes they're there for a week. It just really kind of depends. Sometimes, um, you know, um, sometimes the insurance company will pay for it. Other times the family has to pay out of pocket. But the goal of it is to prevent caregiver burnout, right? Kind of give people, a little bit of a break. What are some risks for falling in homes? So Tom, when we look at, especially with the elderly, what are some of the risks for falls that increase the risk for falls?
When they don't have like the proper lighting in their house and like they can swap out like their rugs for the non-slip ones.
Okay. Yep.
Clutter.
Yep. So, or even just removing the throw rugs, right? Making sure that we have grab bars and handrails on staircases, removing clutter, make sure that there's like a clear path from the bed to the bathroom. Um, Medication safety as well, right? Teaching them about orthostatic hypotension, right? And, not, or I'm sorry, wasn't, well, not jumping up, right? You want them to change positions slowly. With home nutrition and geriatrics, right? This is assessing their IADLs, right? Their ability to obtain food, to cook their own food, as well as their access to healthy food, right? And so sometimes this is where your meals and wheels might come into play. Um, Suspected abuse, reporting abuse. So we are mandatory reporters, right? And so we are required by law to report any abuse. When does that change? When do we ask permission to report abuse?
If they're adults who um like don't have any disabilities, who like if
We
we
don't
call and
ask,
report, it'll
right?
make things worse.
Right? If they don't have a way out, right, then and the abuse may get worse, right? Um, what about home care for a below the knee amputation? So, a below the knee amputation. Um, so some of the things, um, that we may need to worry about, assessing their stump, right? So they, can look at it, um, how to bandage their stump, should they need to, um, how to manage the pain. They'll also need to do exercises. Once the initial surgical site has healed, then they will start using, well, most people will start using compression wraps, or what we call stump shrinkers, to get them ready for oh my gosh, for prosthetic. But they'll also need to be able to move around. So whatever their mobility aids are, whether they're using crutches or they're using a wheelchair, right? Making sure that they're using those safely as well. But your inspection, like looking for at that incision for any redness or signs of infection. um, don't want to put another thing with BKAs too is you don't want to put pillows underneath the knee, or between the thighs when laying down. That actually can actually lead to contractures. So we avoid doing that. What about COPD? How do we teach them about the ADLs at home? Because we know that they may struggle with this, right?
Well, you said we don't put pillows underneath their feet or their knees.
Underneath their, no, not with a BKA.
Oh, okay.
Yep.
Tell them to rest when needed.
Okay, so alternate periods of rest and activity, right? So they should rest, um, to do what they can. Um, we want them to rest before meals too, especially if they're short of breath. That will help to, I know, and sometimes, they may have to get up and cook their own meals, prepare their own meals, and then, um, they may need to sit and rest for a few minutes prior to eating, especially if they get short of breath. Um, Depending on, if they are using oxygen at home, then we have to look at some of the safety issues regarding O2 therapy at home, right? No smoking, be mindful of the O2 cords. Um, But again, they may have to, alternate rest periods with activity, to not, to decrease their shortness of breath. What is the diet for ascites or cirrhosis?
Is that the DASH diet?
The DASH diet, that DASH is, well, let's just say the DASH diet is your, oh my gosh, the
Hypertension.
yeah, it's for hypertension. I was trying to think of what it stood for. I always forget what DASH stands for. Um, Something to stop hypertension. Dietary. So I always forget what DASH stands for, but DASH is for hypertension. So for cirrhosis with ascites, we want to teach them low sodium. So we want to limit their salt to about 2,000 milligrams per day. The focus is going to be on fresh fruits and vegetables. Um, Lean meats. We want to teach them about reading those food labels, right? So we want to avoid the processed items that are high in salt. They also need to make sure that they're getting enough protein as well as carbs for energy. Um, and so um, that's really kind of, the big thing is making sure that they are cutting down on the sodium. They still need to make sure, unless they are unless they are fluid restricted, we also want to make sure that they are getting enough fluids as well. What about home safety following arthroplasty? What is arthroplasty?
Joint surgery.
Yes, thank you. So it's a joint replacement, hip, knee, ankle, shoulder. So some of the things that we want to worry about for following that is, again, just like we talked about earlier with the home environment for the elderly. We want to remove any fall hazards like rugs and clutter. Making sure that, they have whatever they need, kind of like in a hospital room, they have everything they need within reach to decrease their falls. They also want to do like grab bars and stuff in the bathroom. Some they may need like an elevated toilet seat as well. Night lights. Depending on what joint that they had, what's the accessibility? Is it a two-story house? Then we may need to put them on the first floor, right? So that, they can't go up and down the stairs yet. What would be a tertiary following a cabbage? Cabbage is coronary artery bypass rehab.
Stress reduction.
I like that one. Yes, stress reduction. Um, why is that?
Because when you're stressed, you're putting a lot of like stress on your heart. Like
Yeah,
you're getting your heart
yes, your
you're
sympathetic
increasing.
nervous system is kicking in. Yes, very good. Yes. So they're going to do cardiac rehab, which is exercise, education, and support. And so that stress reduction will be part of that as well. Making sure that they are adherent to their medication, and that they're making those lifestyle changes, right? So, smoking, good diet, stress reduction, and then looking at some of the other things that they may need. Some of the medications they'll be on post cabbage would be like your beta blockers for blood pressure. I'm trying to think. They probably will be on oh my gosh, my brain just stopped working. Sorry. Um uh Antiplatelet medication. Oh my gosh. They also may be on a statin for cholesterol reduction as well. And again, a lot of it's going to focus on diet, exercise, weight management, stress reduction. Good job. All right, question. Which of the following tertiary interventions would a home health implement for a 65-year-old has been discharged from the hospital after coronary artery bypass graft? So we just talked about this. Um, so recommend they follow the DASH diet, arrange for them to have a colonoscopy, refer to a cardiac rehab, reconcile the patient's previous medications with their discharge medications, and or provide a brochure on how to prevent heart disease.
I feel like one,
Uh-huh.
3,
Mm-hmm.
and five.
4.
Yes, we always do medication reconciliation, right? Anytime there's a transfer or a transition of care. So very good. So we're going to do following a diet, like your DASH diet, refer to cardiac rehab, and reconcile medications. If they've had a cabbage, they already have heart disease. So the brochure on preventing heart disease isn't going to help at this point. All right, infectious disease. What are the risk factors for HIV?
Compromised immune system.
Risk factors. Like what
Oh,
could increase my risk
risky
of
behaviors like
contracting? I'm
if you
sorry.
get tattoos
Unprotected
for
sex.
like or even
Yes.
sharing tattoo needles, like getting not going to like
Gotcha.
a clean. I can't. My brain's not working, but
I know my
getting
brain
tattoos is
stops too, so I totally understand it. So yes, unprotected sex, sharing needles, injection equipment, having already have an sexually transmitted infection, um, mother to baby. And also too, there's an increased risk with when we look at what do you call it? Alcohol and drug abuse, right? Because that kind of leads to the more risky behaviors when it comes to sex. The populations that are at the highest risk are your gay, bisexual, and other men who have sex with men, Black, African American, and Hispanic Latinos, and then your IV drug users. What would be a secondary prevention measure for a sexually transmitted infection? Secondary prevention. So secondary is
Getting tested.
right? Getting tested. So secondary is screening, right? All right. Um, how do we get active immunity from hepatitis B?
The vaccine?
Yeah, thank you. That hurts too. I still remember that one. All right, hepatitis A. How is hepatitis A transmitted?
Fecal oral.
I know, that's great, right? How do we prevent it?
is that a vaccine too or no?
Yes, hepatitis A, there is a vaccine. So there's vaccines for A and B. We don't have vaccines for C. So hepatitis A is a 2 dose, hepatitis B is three. But yes, it's the fecal oral route, right? Not washing your hands before cooking food, that kind of route. Um, Risk factors for PID.
Multiple sex partners.
Okay. Multiple
Not
sex.
treating your STDs or STIs, I should.
Oof. Oh. Okay. So yes, untreated
I could be
STIs.
wrong. I don't know.
No, you're right. Untreated STIs, especially gonorrhea and chlamydia. Those are the biggest risk factors for PID. Having more than one partner or having a partner that has multiple partners. That also increases the risk, not, unprotected sex. Um, Trying to think of what else. If you've had PID before, you're at risk of getting PIDs again. Um, Tell me about tuberculosis. We're almost done, I promise.
The lung infection.
Okay. It is a lung infection, absolutely. So tuberculosis is a acid fast, slow growing acid fast bacteria. How is it spread?
Is it droplets?
Yep. Airborne droplets from coughing, sneezing, right? Um,
It's both airborne and droplet.
Airborne droplet, yeah. Most people will um that get infected don't even ever develop active TB. It just remains dormant in them. It's about the 10% of the other ones that, will, once they have the latent, it will get reactivated. When do we do a screening? When do we do X-ray for TB?
Is it when they get a positive TB result?
Yeah, so we'll do the PPD initially, right? So that's the tuberculin skin test. You go back, you get it placed, 48 to 72 hours, you go back and you get it read if it is positive. Remember when we look for, and we're looking at a positive, we are looking at induration. So how big is it, not how red it is, okay? Um, and if it is positive, if the PPD is positive, then we'll send them for a chest x-ray. All right. So here's just some more on the hepatitis A. So hepatitis A was a fecal oral route. There is a vaccine. So treatment is primarily supportive. Your hepatitis B is through infected blood or body fluids, sexual contact, shared needles. It can become chronic, leading to cirrhosis and liver cancer. There is a vaccine for hepatitis B. And there's no cure for hepatitis B, but antiviral medications can help to manage the infection and prevent liver damage from occurring. And then hepatitis C is also through and spread through infected blood, like sharing needles and blood transfusions. Chronic infection can lead to chronic infection can lead to chronic liver infection, cirrhosis, and liver cancer. There is no vaccine for hepatitis C, but there are medications now that can cure hep C. So like your baby boomer generations, they had some hep C that they got from infected blood through transfusions prior to us really screening our blood appropriately or effectively. By basically anytime prior to 1990 was the biggest issue. All right, practice question. A client's been examined in the clinic and has been diagnosed with PID. Client asks the nurse to describe this condition. Which description of PID is by the nurse is accurate? So PID is pain that occurs during ovulation. PID is also known as primary dysmenorrhea. PID is the cause of cessation of menstruation or PID is an infectious process that involves the uterine tubes and uterus.
Or
Yep.
Or
Yep. All right. And then the last, cold exposure risk in our homeless population. So we know that if they are homeless, then they are at risk for hyperthermia, frostbite. Um, and then what are the secondary prevention for tobacco? So secondary is screening.
Chest X-ray.
Okay. What else can we do for,
I guess like check for cancer maybe.
okay, ask them
Or
if they smoke.
oh.
Right? I mean, no, like what you're saying is absolutely correct, right? But another one is screening, right? Do they smoke, right? Um, that's, another one. Because, the first one is, um, prevention, right? Is providing the education, right? Especially in our adolescents, right? Not to start smoking, right? But yeah, so screening, right? And then of course, how often, how much do they smoke? And then we always want to offer ways to help them to quit, right? All right. Any questions for me? Sorry,
um
that went a little bit longer.
we didn't have to do whatchamacallit at this point, right? Because it's late. Because I didn't see a HESI practice exam.
There is not one. No.
Okay. All right.
Mm-mm.
Thank you. Just want to make
You
sure.
scared me. I was like, what?